Hi, my name's Becky Potts. I'm a women's health specialist physiotherapist, and I work with my husband, Bill Potts, Perfect Motion Physio. So I'm going to do a talk about pelvic floor. Pelvic floor muscle is one of my favourites, and I'm really passionate about pelvic health. And my specialism being in women's health physiotherapy, a lot of the time I deal with everything pelvic, really, ranging from continence issues to pain to prolapse problems. And I work really closely with women prenatally, postnatally, and also women going through menopause and the other side of menopause. So yeah, my passion's really very much around the pelvis. So I thought it would be useful to do a talk thinking about the Calgary Wellness event about continence and the pelvic floor. So continence issues affect 1 in 3 of all women, and that's women that we know about and that have admitted to having problems with continence. So actually probably the statistic is an awful lot higher. So 1 in 3 in terms of urinary incontinence. Fecal incontinence, it's about 1 in 10. So quite a high prevalence, really, in terms of population. And happens at different walks of a women's life. Sometimes women can suffer with incontinence, which fluctuates. Sometimes it's consistently there and just ignored. But any amount of leaking is not normal, although it is a very common thing to suffer with, it's not normal. So what I'd like to do is just to educate you all a little bit more about the pelvic floor, about what things can go wrong with it, how is best to address it, and how to do your pelvic floor exercises. So I've got a model of the pelvis here. So if we look at the pelvis, this is the front of the pelvis, and then looking here at the back. So inside your pelvic cavity sits your pelvic floor. So it's a hugely powerful, strong muscle. It sits like a hammock inside the pelvis, and it spans back to front. So collectively, your pelvic floor works to help support your internal organs. So it helps to hold everything up. There can be issues around trauma to the pelvic floor, such as childbirth or trauma to the lumbar spine, that can involve the pelvic floor and stop it working quite properly, but also issues related to menopause and changes in estrogen levels, which can affect how the pelvic floor can function, which can then sometimes lead to leaking. So what we need to think about is integrity of the pelvic floor, when it's working well and when it's not working well. So if you have any symptoms such as persistent pain around your pelvis, that's something that you need to get checked out by a physiotherapist, ideally a women's health physiotherapist. If you have any feeling of vaginal heaviness or a dragging sensation, that's also not a normal thing to feel, and it can indicate that there is perhaps an underlying prolapse. So a prolapse is essentially where one or more of your internal organs drops down through your vaginal entrance, or sometimes it can drop down posteriorly through your anus. So if you think about where your internal organs sit, so looking at the cavity again here, so the front of the pelvis is here. You have your bladder that sits at the front. You have your uterus, which is in the middle, and then you have your bowels at the back. So all those 3 are really interconnected, and there's a huge correlation between gut health and pelvic health. Nicola Russell is obviously the lady to see if you have any issues relating to IBS-related symptoms or issues there. But often I see lots of ladies who have pelvic floor dysfunction, and there's also a bowel component there in terms of constipation, bloating, that side of things. So pelvic floor doesn't just work on its own, it's a whole multifactorial component going on. So with prolapse, you can get this dropping down. So if you're feeling any sensation of vaginal heaviness, dragging, then that's something to get checked also. Intercourse. So if you get any pain with intercourse at all, so either around your vulva, vaginal entrance, anything that's deeper with intercourse, or even around your sacrum, so around the very bottom part of your low back, that's also not normal and something to get checked. And back to leaking. So what I would like to do now is to think about pelvic floor, how it activates, how you should activate to do your pelvic floor exercises. So if you think of your pelvic floor in layers, so you have superficial part of your pelvic floor. So if I hold up the pelvis here, you should be able to see the superficial component of your pelvic floor there. So I'm going to upturn the pelvis so you can see a bit more clearly. So at the back, so the pelvic floor attaches right at the back. So if you imagine you're stopping yourself passing wind, you should get your sphincter around your back passage working. Then you want to translate that pelvic floor activation more anteriorly. So you then want to come forward and think about lifting from your vaginal entrance as if you're drawing up a heavy tampon or gripping around your partner, and then lifting up around your urethra as if you're stopping yourself going for a wee. So ideally with your pelvic floor, you lift up back to middle to front. So it's a kind of wave contraction. So if you think about it in terms of an analogy of a lift, if you step into a lift and you imagine the lift doors closing, that's you getting your superficial part of your pelvic floor closing off. What you also then need to do is to work the deep part of your pelvic floor, and that's where we think about the internal aspect. So when you're getting the deep activation, you're drawing up internally. So you're thinking about going up on that lift one floor at a time. So you have the superficial closure of your pelvic floor, working back, middle, front, and then you're drawing up internally. So the other thing to consider when you're lifting your pelvic floor is that ideally you want to do that on a breath out. Lots of ladies that I see in clinic breathe in, brace, hold their breath, try and grip onto their pelvic floor, but actually breathing is so important. And it's so important to get your diaphragm working in conjunction with your pelvic floor. And if I explain it in terms of pressure gradients, it's often a lot easier to understand. So when you take a breath in, you think your abdominal cavity is here. When you breathe in, you take air into your lungs expand, and that pressure comes down into your abdominal cavity. When you breathe out, the pressure decreases. So with the change in the pressure gradient, you can get a better lift of your pelvic floor and get that roof of your core working in conjunction with the floor of your core, your pelvic floor. So the diaphragm being the roof, the pelvic floor being the base. You get the two working together. So you want to breathe in. If you try it now, breathe in, be completely relaxed. And then as you breathe out, you want to think about closing the lift doors. So you're lifting up from your back passage as if you're stopping yourself passing wind, drawing up from the middle as if you're lifting a heavy tampon, and then from the front, stopping yourself going for a wee. And then draw up internally, lifting up to the top floor of the lift. Once you've reached the top floor, you then want to slowly start to relax down and take all the pressure completely away from your pelvic floor. So you're taking the tension away, but also going right the way down to the basement. So you're not holding any residual tension at all. And that's so important with your pelvic floor. And there's actually quite a high proportion of ladies that I see clinically who have incontinence, which actually is caused by an overactive, tight pelvic floor. So it's not that you need to be going around gripping on lifting your pelvic floor all the time. You shouldn't be doing that. You need good quality contractions, be contracting in the right way, and making sure you fully relax off after. And really getting a full pelvic health assessment from a women's health physio is so beneficial, because you don't really know if you're contracting properly unless you have it assessed. So worth considering. So to run over that again, so your pelvic floor lift, you breathe out, lift back, middle, front. You think about closing the lift doors, you draw up on the lift right the way up to the top floor, and then you take all the tension away, and then relax off completely. So ideally, when you lift your pelvic floor, it should just be that internal lift that you're getting through your pelvis. You're just getting these internal muscles working along with the sphincters. You shouldn't be gripping on with your legs, tensing up, squeezing your bum really tight. With a maximum contraction, you might get a little bit of abdominal activation. You might feel your bum tightening slightly, but really it should just be an internal lift that you get. So the difference with how you do your pelvic floor exercises also falls into two categories of short lifts and long lifts. So you need your pelvic floor to help to support your bladder when you cough, sneeze, run, jump, and the common trampoline story of ladies leaking on the trampoline. So you need to be able to get that short, sharp lift. So when you exercise your pelvic floor, make sure you're adding in those short lifts. So breathing out, lift your max, breathe in, fully relax off. So you're not holding it for any length of time. But you also need endurance for your pelvic floor. So that's where it's working consistently and holding you continent. And that's particularly prevalent in ladies who suffer with urge incontinence, and that's where you have a full bladder, or it might not actually be full, but it might feel full, and you need to get to the toilet quickly, otherwise you're going to leak. And often that's described as when you're coming home, say, and you've got the key in the front door and you're just absolutely desperate to get to the toilet, you can't get there quickly enough. So you need to be able to hold your pelvic floor for a considered amount of time. If you aim, everyone's pelvic floor is different and you'll have different levels of function. So some people will need to be able to hold their pelvic floor at maximum contraction for longer than others. So it varies a lot person to person. So there's not a kind of general specified, this is what you should do. However, it's good to have a baseline there, and we know that it takes, on average, I think it's about 7 years for people to come and seek help from a women's health physiotherapist, on average. Some women are very good, very proactive, but often not so. So it's great if you can just start doing something, even if you're not feeling like you're wanting to come and have an assessment. Start doing something proactively for your pelvic floor if you're suffering from any leaking at all. So on that note, go for this generalised recipe of pelvic floor exercises. So for your short lifts, you want to be aiming for 8 to 10 repetitions of your maximum effort of a short lift, okay? And then for your long lifts, aim for 8 to 10 seconds of a long hold, okay? And then you want to try and get to a point where you can repeat that for 10 cycles. So your short lifts, 8 to 10 short lifts, and then your long lift, you want to hold for about 8 seconds or 10 seconds and get to repeating that cycle up to 10 times. If you feel like you can't do that, that's absolutely fine. Just work with what you've got. Don't push yourself too hard too quickly. Those cycle of pelvic floor exercises you need to be doing 3 times a day to 5 times a day if you're suffering from, particularly from stress urinary incontinence. So when you cough, sneeze, jump on a trampoline. So try and aim for that. And over about 3 months, a bit longer than that perhaps, you should hopefully have a vast improvement in your symptoms. If you don't, or if you're still suffering with leaking at that time, then seek help, because there's loads that Women's Health Physio can do for you. And it might be that you're just not quite contracting your pelvic floor correctly, or there might be other things going on. It's definitely not just about the pelvic floor. And really, certainly with my women's health assessments, I consider the woman head to toe, and that's so vitally important, because posture's a big thing to consider too. And if we think spinally about your pelvis is kind of like a keystone of a bridge, so it holds your spine and gives you really good structure and support. However, if you have issues going on higher up and through your spine, or knee pain or foot pain, your feet, for example, they form the foundation of your core. So if you're off kilter with your feet, it can throw off everything else. So it's really important to address the whole body system. And as I was talking about diet earlier, and that ties in with that. Thinking about your lifestyle, about how that might be impacting your pelvic health. and thinking about core. And both myself and Bill love Pilates, and we teach a lot of classes. It's so beneficial for lots of our patients that we see, in terms of getting their bodies working better for them, thinking about posture, how you hold yourself, how you move. So your diaphragm forms the roof of your core, as I mentioned earlier. You've got the pelvic floor at the base, and then you have transabs at the front, so it forms like your frontal kind of corset sling, and then multifidus, which is the spinal muscle that runs at the back. So those 4 muscles work in conjunction. So it's never just about the pelvic floor. There's always lots of other things to consider. But hopefully that's given you a little bit of a food for thought, really, in terms of pelvic floor health. And incontinence is very, very common, but it's absolutely not normal, and it's something that can be sorted. So try those exercises. Please do go and see a women's health physio if you're suffering with any issues, or be very open to chatting to anyone if they have any questions. So do get in touch, and look after your pelvic floor. It's yours for the rest of your life. So it's an important muscle.